Okay, so the first topic is about electronic health record. So this is the table of content of this topic. The first one is introduction to different types of EHR system, and then understanding common features and functionalities, patient record scheduling, and e-prescribing. And then data entry accuracy and maintaining patient confidentiality within EHR. Okay, so the next part is about introduction to different types of EHR system. Electronic health record system are digital platform used by healthcare providers to manage patient information and streamline clinical workflow. There are several types of EHR system, each tailored to a different organizational needs, ranging from a small clinics to a large hospital network. Here's an introduction to the main types. Firstly, physician-hosted EHR system. Description of this topic is the EHR data is hosted on the physician-owned server, and then the pros is a full control over data and security, and the cons is a high upfront and maintenance costs require in-house IT support. And this is best for medium to large practices with technical resources. Secondly, it's about remotely hosted EHR system. These systems are hosted off-site, typically in the cloud. Okay, there are two types. Subsidies, it's a vendor-hosted EHR. Description, the EHR data is hosted on the physician-owned server, and pros is a full control over data and security, and the cons is a high upfront and maintenance costs require in-house IT support, and this is best for medium to large practices with technical resources. And then a dedicated cloud-based EHR. The description itself is accessed over the internet. Data is stored in the cloud. And then about the pros is scalability, easy remote access, minimal hardware requirement. And about the cons is dependent on internet connectivity, potential data security concern. And this is best for small to mid-sized practices, mobile health services. And then thirdly is about open source EHR system. Description, system with source code availability for modification. Example, OpenEMR, OpenMRIs, and then the pros is customizable, lower cost, and then the cons, it's require technical expertise to install and maintain. This is best for organization with IT development capabilities or in resource-limited setting. Then, specialty EHR system. Description, tailored to specific medical specialties like oncology, cardiology, and pediatrics. Pros is a features and template designed for a specific clinical needs. And then the cons is a lack of versatility for multi-specialty practices. And then this is best for specialty clinic and practices. Then integrated EHR system. The description itself is integrated with practice management, billing, and lab system. And pros, it's streamlined operation, reduced data duplication. And cons is higher complexity, may be expensive. This is best for a large hospital or healthcare network. Okay, the next topic is about understanding common features and functionality. It can be patient record, scheduling, and e-prescribing. Okay. EHR, electronic health record system, are designed to enhance healthcare delivery by providing a centralized digital platform for managing patient information. Despite differences among vendors and types, most EHR systems share a set of core features and functionalities that support clinical, administrative, and billing tasks. Here an overview of the most common ones. Firstly is a patient record management functionality, centralized storage of patient health data, including medical history, diagnosis, medication, allergies, immunization, lab result, and visit notes. And the benefits are, firstly, is a quick access to comprehensive patient data, and then better coordination among providers and reduce paperwork and duplication. And then the second one is appointment scheduling. The functionality is calendar-based scheduling system for patient visit, follow-up, and provider availability. The features are appointment reminder via SMS or email, waitlist management, integration with patient portals. And the benefits are reduced no-show rate and more efficient workflow planning. Next, it's about e-prescribing. The functionality allow provider to electronically send prescription to pharmacy. The features are, first is a drug interaction check, and then medication history tracking, and then prescription refill requests. And about the benefits are improved medication safety, reduced prescription error, and faster pharmacy processing. Next, it's about laboratory and imaging integration. The functionality, electronic ordering of lab tests and imaging with result automatically imported into the patient record. The benefits are faster turnaround time, and then secondly, easy tracking of orders and result, and enhanced diagnosis efficiency. Okay, billing and coding support. The functionality is a tool to automate medical billing, including CPT or ICD coding, claim submission, and payment tracking. The features are insurance verification and claim denial alert. And the benefits are reduced billing error and quicker reimbursement. And next, security and access control. The functionality, role-based access, audit trails, and data encryption. And then the benefits are ensure patient privacy, HIPAA compliance as well, and tracks who accesses or edit records. And then clinical decision support. The functionality are provides alert and reminders for best practices, drug interaction, and preventive care. The benefits are support evidence-based decision, reduce error, and improve outcome. Next is patient portal. The functionality, a secure online access for patients to view their health record, communicate with providers, schedule appointment, and request review. The benefits are empower patient and then enhance engagement and satisfaction. And then interoperability and data sharing. The functionality secure online access for patients to view their health record, communicate with providers, and schedule appointments and request reviews. The benefits are facilitate continuity of care and improve transition between providers. Okay. Data entry accuracy and maintaining patient confidentiality within EHR. So, ensuring data entry accuracy and maintaining patient confidentiality are two of the most critical responsibilities when using electronic health record or EHR system. Poor practices in either area can lead to clinical errors, privacy breaches, and regulatory violations. Here, a detailed look at both. First, data entry accuracy. The challenges are: first, human error during manual entry, like typo, wrong patient selection, and then autofill or template misuse, leading to incorrect and or outdated information, and then copy-paste error when old notes are reused without verification. Best practices: standardized data entry protocols, use consistent format for names, date, and medication, and then apply structured fields where possible, like drop-down for diagnosis codes, and then double-check patient identifier, always confirm full name, date of birth, and patient ID before entering or updating record. Next, limit copy-paste. Use with caution and always verify relevance and accuracy. Consider EHR with audit logs that track copied content. And then training and competency. Regular staff training on how to accurately enter and update record. And then emphasize the clinical impact of incorrect data. Next, use of decision support tools like alert for inconsistency or missing information, and then auto-flagging of unusual entries. For example, high doses for a child. Maintaining patient confidentiality. The risks are authorized access to patient record, insecure transmission of a storage of data, and then loss or theft of devices with stored health information. And then best practice are: first, role-based access control. It can limit data access based on job function. For example, receptionists shouldn't access the clinical notes. Secondly, authentication measure. It requires a strong password and multi-factor authentication, and then use automatic timeout for inactive section. Okay, audit trails is a log all access and edits to a patient report. Regularly review logs for unusual activity. Then encryption. It encrypts data both in transit and at the rest. Next, compliance with regulation. Follow HIPAA and then GDPR for Europe and applicable local law. Keep policy updated and provide periodic privacy training. And then secure communication tools. Use only approved and script messaging system for a patient information. Avoid sending a PHI via unsecure email or SMS. Okay, that's all about the electronic health record. This is just the information for some courses that VIA Bootcamp services provide. You can read by yourself, and you can follow our social media, email, or WhatsApp if you want to know more about this course. Thank you for listening. So we move to the second topic.